Most OT students, and even new clinicians, get this part wrong. They document an activity analysis when what they really need is an occupation-based activity analysis, or the opposite. And the difference affects your documentation, your clinical reasoning, and your client outcomes. Today, I'm breaking it down simply and clearly. Welcome back to Occupational Therapy Soap Note, the channel where we make OT documentation simple, clear, and actually meaningful. Let's talk about activity analysis versus occupation-based activity analysis, and when to use each one. An activity analysis looks at an activity as it is typically done, without a specific client in mind. Think of it as looking at the general demands of an activity. What are the steps? What are the motor and cognitive skills are required? What are the objects or tools are needed? What are the space and sequencing demands? For example, if we analyze putting on a shirt, we're not thinking about a specific person. We're looking at the universal steps and required abilities involved. Activity analysis is great for teaching students, understanding task components, designing interventions, breaking down everyday tasks into manageable pieces. It is broad, general, and not tied to one client. Occupation-based activity analysis is completely different. Here, you analyze the activity with a particular client in mind. Context becomes everything. We ask, what is meaningful about this occupation for this client? What is their environment? What supports or barriers affect their performance? What personal factors change the demands? What are their cultural or social influences? Example, let's say the occupation is getting dressed. For one client, the biggest challenge may be standing balance. For another, it might be cognitive sequencing. For someone else, cultural dressing practices may change the steps entirely. The occupation stays the same, but the analysis completely changes when it's person-centered. This is the analysis used in evaluation, intervention planning, and documentation. 1. Focus activity analysis.